So this is a big challenge for us. I think for all infectious disease, the principle for the prevention and control is almost the same. We need to identify the source of infection, cut the chain of the transmission, and protect the susceptible persons. So the early identification, early reporting, and early quarantine and early treatment are significantly important. Next, I would like to introduce some of the instruction to the public in China during the pandemic. I think most may be the same as you do in your country, so I will go very quickly. As we know, during the pandemic, every individual, they could be a susceptible person, but they can also be a potential resource of infection. So protect themselves and protect others are very important. And these general prevention measures should be educated to the publics. We advise the publics to have the hand hygiene, respiratory etiquette, and keep social distance. In China, we ask them to keep at least more than 1 meter, but in other countries, maybe 2 meters. I think that's fine. And also, we educate the public to wear masks when they are being out, and stay at home if not necessary, and no gathering. And we also ask each employees to have their health report to the employer every day, so that we can know the health status for each employees, and take the measure as soon as possible. And the government also developed some very useful prevention measures. For example, like the temperature control when you want to access an indoor places. And they also developed the movement track app so that everyone can have a health code. The picture looks like on the right. You can see there's 3 colors. The red one color for the red code means this person actually should be quarantined. He may be under the medical observation period. And the orange one means that you can he may just be back from the epidemic area and should be in the 14 days observation period. And the green one means there's no evidence that you are during the quarantine and the observation period. So only you have the green code, you can go shopping and go to work. So the green code is very important for everyone. That means you are healthy. And the government also call for be avoid to the medical visit if unnecessary, because during the pandemic, the medical facilities should be high-risk places. And for those who have symptoms, we have a very important facility that is called the fever clinic. If the person you have the symptoms, and you should go to fever clinic first, and then if you can you are excluded with the COVID-19, and then you can treat as usual. If you are suspected or confirmed as COVID-19 cases, and then you will be quarantined immediately. And if you are presented the severe symptoms, and then will be admitted to the hospital. Next, let's see how what's the impact of the SARS-CoV2 pandemic on the hemodialysis service. We all know that ESRD patients are particularly vulnerable to the infection because they have a lot of risk factors. Most of them have less efficient immune systems, and a lot of patients are older and they have a lot of comorbidities. And actually for them, it's very difficult to completely cut the chain of the transmission because they need to frequently to and from hospital or clinics to receive the treatment. And it is impossible to be isolated completely due to the in-center dialysis cluster treatment. And the droplets and contacts are always exist actually in the hemodialysis center. Once the patient was infected, he actually can be a moving source of infection. So therefore, all the measures must be taken very seriously to take them safe. This is the incidence and the mortality Dr. Melin just asked. I don't want to repeat the incidence, but I would like to show you some data that in one paper it is showed that very interesting. Most of the cases, the patient infected by the COVID-19, they with no symptoms or only mild clinical signs and the symptoms. The modality actually, you can see that among 33 infected patients, 6 patients died, but they are not died of directly to the pneumonia. Their death cause are due to the cardiovascular and the cerebrovascular disease and hyperkalemia. By the author of this paper, he thinks that is mainly because this patient missed some treatment. They want to avoid possible infection, so they just missed some treatment, and that may be the cause for the death. For the medical staffs, I didn't show this data. There's totally 4 medical staffs infected by the COVID-19, but their outcome is quite good. And then once the other impact of the COVID-19 on the hemodialysis may be to our healthcare system. Once the patient was infected, he has to be treated in a designated hemodialysis center, and patients and staffs in the same shift should be quarantined as a close contact for medical observation. So as we know, the dialysis service requires very special resources. So this puts the healthcare system under additional strains. Besides the impact for virus per se, the impact from outside environment cannot be ignored as well. The outside impact including like the city lockdown, there's no transportation, road closed, and the community access control that caused our both staffs and the patients to reach the dialysis center very difficult. And the second is in some hospital during the pandemic was taken over by the government as a designated one. So those non-infected patients had to be transferred to other medical facilities. So it brings us a lot of coordination work. And the third, during that period, the essential healthcare was squeezed, that like the non-emergency services were reduced and closed, and the medical staffs were deployed to support the COVID-19 treatment. And like some of outsourced lab was closed. So this also brings a lot of difficulties for us and for the patients. Here I show you a news report the title said, "No dialysis means death, plight of uremia patients during lockdown." As usually said by our dialysis patients, that without dialysis, I will be 100% die, while I have more than 90% chance to alive, even I'm infected by SARS-CoV2. However, each life-sustaining trip is actually full of unknowns for them. And next, I will tell you some management in China during the pandemic, how we did. During the pandemic, it is very important to establish a very strong leadership team, including multiple professionals. And the responsibility of the team is to organize training and education, and to help effective staffing, and to oversee the supply chain, so that to ensure our front line staff to have enough appropriate PPEs and medical supplies, and to conduct the surveillance of COVID-19 so that proper strategies and plans can be implemented. And also they are responsible for developing networks with the local and the regional providers, and keep the communication with the government and the COP leadership team so that they can share limited resources and best practice and seeking support if necessary. They are also responsible to develop a contingency plan and assure all the plans in line with the national guidance. And to avoid the mixture of infected patients and the non-infected patients, triage should be done every day for every patient and everyone who wants to enter our dialysis center. The temperature measurement should be done at the entrance of the dialysis center. This is different from those as we did as usual. We need to move the checkpoint from the treatment area forward to the entrance. And if the patient was found their temperature more than 37.3, and then they will refer to the fever clinic. And we also need to ask the epidemiology history and if they have some symptom related to the COVID-19. And for those new and return patients screen, there's another special process. I will talk later. Here I show you our patient flow. When a dialysis patient comes to our dialysis center, and they will be screened first by the symptom, contact history, and the temperature measure. And if it's necessary and it's available, maybe CBC and chest CT can be done. And then if he can be excluded with COVID-19, he can enter our hemodialysis center to receive the treatment as usual. But if it cannot be excluded, then he should refer to the fever clinic. So fever clinic is very important in China as the first line of the defense of in this battle. And in the fever clinic, they would have further examination, and if it can exclude the COVID-19, then they will go back to the original dialysis center, and we will follow his symptoms. If it's relieved, then they can dialysis as usual, and if it cannot persist in several days, and then they will refer to fever clinic to check again. And then if the patient was suspected be infected, then he will be dialyzed in isolated hemodialysis center. when he was excluded, then he can be back. However, if he was confirmed as a COVID-19 patient, then he has to be sent to the Hemodialysis Center in a designated hospital. So this is the normal patient flow during the pandemic for our Hemodialysis Center. In addition to the triage, the staff training and patient management is another very important aspect. The knowledge is power. So when you have the knowledge, you will be clear to know how to deal with the problems depending on your own situations. So during the pandemic, we think all the staffs need to know the knowledge and the guideline of COVID-19 and know how to protect themselves, what's the appropriate PPEs, and they should initiate to report their health status. And if they feel not good, they should stay home while not on duty. And the training was recommended by WeChat, online teaching, and self-study, while not the face-to-face gathering to avoid the cross-infection. And for patients, like the hand hygiene, respiratory hygiene, and cough etiquette are educated. And they also asked to report immediately to our clinic staffs and by the phone. Why not go directly to the clinic? Maybe they are encouraged to go directly to the fever clinic to make a screen. Actually, during the pandemic, although it is a challenge, it is also a very good opportunity to deliver our infection control education and training to the patients and the staffs. I think there's a lot of ways to educate our patients, but the key point is you should make the education more interesting and easy for patients to understand. Here, I just give you an example of the education. We designed a series of comic story describing a patient. His name is Uncle Chan. Zhai means fighting and struggling in Chinese. And we described the 24 hours life of Uncle Chan. In this story, a lot of knowledge was delivered to the patients, like how to wash their hands, how to wear their mask, and how to deal with the load clothes, and how to take the public transportation and so on. Because it's the 24-hour life, so it's almost covered all the knowledge patients should know during the pandemic period. And to keep patients safe, we also request the dialysis center to check the patient's body temperature before they enter in the centers. And patients are also asked to arrive just on time as scheduled, while not arrive too early to avoid the cluster in the waiting room. And they were asked to wear a surgical mask throughout the session, wash their hands, keep social distance, and also no eating and less talking during dialysis. They would ask to keep relatively fixed shift so that they can avoid to contact other patients. And the caregivers are not permitted to enter the treatment area during the pandemic. So next, I here would like to have your opinion. Do you agree that hemodialysis patients should wear masks throughout the dialysis session? Yes or no? Please put it.
So just to make it very clear, guys, this is to any hemodialysis patient. This is not necessarily for suspected or.
Yes, this is any.
All patients. So meanwhile, I would also like to say we have a lot of questions coming in, which is great, and we have extended the time of the webinar to have a good Q&A session towards the end. If there are some really contextual burning questions, then I might raise them up at the during the time, but mostly we will try to keep them towards the end. So we have been going through this process of finding masks. In these times it is not easy to get masks for staff, let alone patients. But let's see what people feel. We'll give a few more seconds for the polling to come through. We have about 64% people have voted by now. So let's wait for another 10-15 seconds. Okay, we have majority of people voted, and I think the response is very clear. So, Grace, do you want to show the response? I don't think you are going to get any prizes for guessing here.
Yeah. Okay. Actually, I think the answer might be depends on different situations and different culture and different patients. Mostly, I think wear mask is very important for prevention of cross infections, but sometimes we still need to consider the individual situations. Like some of our patients, they have the COPD, they need the oxygen treatment, so mask may be not benefit to him, but if they can, they feel they are well to wearing, we encourage them to wear the masks throughout the dialysis center. And but for some special individuals, I think maybe keep friendly distance with others would be a better choice. Okay, let's continue. For the staff management, we asked each staff, they have the daily health report. That is a zero report. Why the zero report? Because sometimes the staff maybe forgot to report. Then we can know very quickly and to track his health in time. And also each staff have to be on the temperature measure, take the temperature measure, and they should implement standard precautions, including the high hygiene and the PPEs. For the standard dialysis, we upgraded PPE. They should wear the surgical mask, face shield, and head and gowns. So this is for standard, but for the confirmed or suspected cases, caring person, the PPE would be upgraded, and I will talk later. And for the test of the virus and also the chest CT screen, actually we didn't do that during our pandemic because one is because the virus test is not available in our clinics at that time. It can only be done in a designated lab. So we are not available to do that. And the chest CT, we are not regularly for screen for our staffs and our patients because that usually is in the hospital, and at that time the hospital is a high risk places. We just ask those like the new patients or some patients with symptoms to do that. So this is for these two questions. And then the other very important part is the environment and the equipment cleaning and the disinfection, because this is a very important part in the infection control. But most, I think, is the same as we do as usual. during the pandemic, actually we take another 3 measures that is made different from the usual. One is we ask to open the windows for more than 30 minutes between 2 shifts. And the other is we ask to turn on the air ventilation equipment if it is available. And the other is we ask to have the air disinfectant spray and or UV radiations after daily work. So this is the additional 3 measures besides our usual control policies. And then like the surface cleaning and equipment disinfection and the medical waste management policies. This is all management. This is always we should implement it strictly according to the policy. And then in order to ensure all the patients they can receive the hemodialysis as usual, we provided some measures like we help them to deal with the city lockdown and road close. We provided the transportation to pick up and drop off some patients when they have difficulties. And we also provide patients with the disease certification and communicate with the community manager in advance to help patients deal with the city lockdown. And also we have to manage the staff accommodations and the work time schedule was adjusted. There's a lot of cooperation between the staffs and the staff and patients. So the united is very important. And also we should pay attention to the psychological problem for both our staffs and the patient. So we also give some support as many as we can. For the new and return patients, because this is this population maybe have more risk than our usual patients. So we decided to give them additional admission procedure. During the pandemic, actually we recommended to minimize patients' transference. But if you want to admit new patients, the specific screening procedure should be followed. We should ask them to investigate the epidemiological history and take the chest CT scan and take the temperature measure and also the CBC. And those new patients and returned patients are required to stagger in and out time with others. And their treatment places should be in a separate area or a separate room for 14 days. And of course, this is depending on your own situation in the dialysis center. And their activity area in the center should be limited during the 14 days. And then I will move on how we should respond in a case of the exposure to COVID-19. Usually, there's several types of patients we may be encountered during the pandemic in clinical practice. One is those patients with symptoms, but that symptom is not maybe similar to COVID-19, but he is not a COVID-19 patient. This is one type. The other type is the patient under medical observation, including those who is a close contact and who is just come back from a pandemic area. And the third is those the suspected and confirmed patient. And the last, the patient maybe have a caregiver or his family member was defined as a close contact. So this 4 kind of patients maybe we will encounter in the clinical practice. Let's have a look. For those symptomatic patients with COVID-19 be excluded, they can receive the treatment in the original dialysis center. However, we will schedule their station, put their station in the end of the row, and keep some distance from others. And the staffs, the nurses' PPE is the same as usual, and they will follow that with the symptoms. And for those patients who are under the medical observation period, they should be treated in a separate isolation room, or if it's available, or if it's not available, they should be in the last shift in the end of the row, so that to avoid them contact more patients. And for those patients, the PPE is the same as for confirmed cases. So the PPE requirement is much higher than usual. And then they will, after their treatment, the environment disinfection should be intensified. And according to China guideline, all the suspected and confirmed cases should be transferred to a designated hospital for isolation treatment with the effective protection measures in place. But for those suspected cases, they can only treated in isolation in a single room for the isolation single room. But for those confirmed cases, actually they can share a room with multiple stations because they have already been confirmed be infected with the infections. And for those critical severe cases, and then they will be admitted to ICU for CRT. Here I show you the PPE requirement for the quarantine dialysis. First is the mask. They should wear the N95 mask, and in some area like in Wuhan, plus surgical mask. That means 2 layer mask, 2 masks are required for those staffs who serve the quarantined patients, and should wear Google and full waterproof isolation gown and the shoe cover, and also gloves always. And the staff should be relatively fixed. And for those staff who serving this quarantined dialysis patient, they should be self-isolated for 14 days after curing this patient. And then they can move to curing the normal patients. Okay, let's take a couple again. Here I have a question. Patient arrived and informed that he has family members on self-isolation due to contact with a confirmed case. What will you do? Number 1, provide dialysis treatment in an isolation room. Number 2, provide dialysis treatment during last shift at the station in the end of row. Number 3, transfer to a designated medical facility for screening to exclude COVID-19. Number 4, provide dialysis treatment as usual and follow up. Let's start pulling.
Okay, thank you, Grace. So I would also like to just quickly remind our participants in the meanwhile that we will continue beyond 1 p.m. Because I think there's really a lot of questions and we would like to go through as many possible. Or there is, of course, significant overlap in the questions. So please stay tuned after 1 p.m. if your timing allows. If not, then please we will make a record of your questions and try to get back to you. But we have extended the session till about 1:30 just to try and be able to get as many questions answered as possible. So now we still have quite a lot of. We'll give a little bit more time for this polling because this is quite an interesting question, and we don't want to split the beans here. But
okay. So maybe
shall we just hang on for 10-15 seconds more? About only 50% have voted. So maybe 15 seconds for more voting. Okay, so last 5 seconds for the voting to come through, and we will close after that. Okay, let us close the poll. Thank you.
yeah, I see the results. Actually, I think most they choose 1, 2, 3, and I think it's fine. Depends on your own situation. But I would like to share with you the China guideline. The China guideline actually suggested that patients on dialysis who have a family member or caregiver subjected to quarantine and medical observation can have dialysis as usual during the 14-day period. I think this is depending on the China situations. But once the family member or caregiver of the patient on dialysis have been converted to confirmed cases, and then the patient should be upgraded. So this is from China guideline. I think you have your own situation, so you can just think about how we can do better and what's the resource we are available, depend on your own situations. Last, let's briefly introduce the dialysis in convalescence in China. In China, when the patient want to discharge from the designated hospital with COVID-19, he should have the temperature, body temperature to normal for 3 days.
Grace, sorry to interrupt.
Yes.
We are still on the polling question. Can you go back to your slides?
Oh, okay. This one.
Dr. Grace, can you try to share your screen again? Thank you.
I'm sharing my screen.
Okay, yeah, we can see it now.
We may continue now. Thank you.
Oh, okay, okay. So can we continue?
Yeah, you can continue. Yes, please. We can see your screen. Thanks.
Okay. So did you see these slides before? I introduced the guideline from China for the family members who have a caregiver defined as close contact. The patients on dialysis who have family members and caregivers subject to quarantine and the medical observation can have dialysis as usual during 14 days period. And then if the family member have been converted, diagnosed as a confirmed case, and then the control measure to the patients should be upgraded. So this is from the China guideline. And I suggest you can think about it according to your own situations. The main principle is we protect the patients. And then the last part is the dialysis in convalescent. And first, I will share with you the discharge criteria for the COVID-19 patients. When the patient wants to discharge from the hospital, they should have the body temperature to normal more than 3 days. Their respiratory symptom should be improved obviously, and the inflammation on pulmonary image show obviously absorption. And then the virus test the nucleic acid test should be negative twice consequently. The sample interval should be at least more than 24 hours, and the sample should be respiratory tract samples such as sputums and nasopharyngeal swabs. And then after discharging, the patient should have the self-quarantine for another 14 days. This 14 days, they are managed by the primary care facilities and the community social workers. The patients are suggested to live in a well-ventilated single room. They should monitor their health status and report every day, and they should minimize close contact with family members, and have separate meals, hand hygiene, and avoid going out. And after this 14 days, they will revisit the designated hospital which they discharged from, and to recheck their health status, and also on the day 28 as well. So according to this discharging procedure for our dialysis patients, when they are discharged from a designated hospital-based hemodialysis center, they have already have the nucleic acid test negative for at least 2 times. In Wuhan, actually, I know in practice, they test this patient for 3 times. If all the 3 times tests are negative, then the patient will be discharged. After discharge, they will be sent to a dedicated hemodialysis center to receive the treatment for another 2 weeks. And after 2 weeks, they will test the nucleic acid for 2 times. If both are negative, and then they can go back to the original hemodialysis center. But where recommended, their treatment should be scheduled in the last shift and for another 2 weeks, and they should be followed up for the symptoms. And then after 2 weeks, they will test the nucleic acid again, and if it's all is fine, and then they can dialysis as usual. So this is the recovery phase for the COVID-19 patients, the procedures. So that's almost all I want to share with you. Then at last, in summary, we think that COVID-19 has turned into a global pandemic, bringing a potential risk to each of us. So everyone should be united to fight against coronavirus. And the hemodialysis patients are one of the most particular vulnerable populations to be infected. All measures to keep them safe and prevent virus from spreading must be taken very seriously. And the triage, personal and facility management should be considered in hemodialysis center, and contingency plan should be ready for the SARS-CoV2 exposure, early identification, early reporting, early isolation, and early treatment are very important. That's all from me. So thank you very much for your attention. questions and answer.
Yeah, thank you, Grace. So we have prepared a list of questions, and we have quite a few. I don't think we'll be able to get through each and every question in a full comprehensive way, even in these 30 minutes. So we've had to prioritize, and let me start. One very interesting question is, have you got any idea of whether there is any COVID testing in blood donors? So I presume these are asymptomatic blood donors, and if there's any trends of what are the COVID infectivity in this group?
You mean the blood test?
No, for blood donors, asymptomatic blood donors. Do you do COVID testing?
Actually, we didn't make that because in China, for the hemodialysis patients, we very few to infusion the blood, have the blood infusion. So I have
not for hemodialysis patient. I think in general,
in general. I think they should because the plasma therapy was recommended in the late stage to those patients, and for the donors and for the plasma infusion, they test the COVID-19.
Okay, so for the time being, we do not have a handle on the numbers of positivity in the blood donor groups, right? It's okay, we can answer that question later. Then there is a lot of interest in the fever clinic. Okay, that is a very interesting concept. I personally have not seen that being done in many other countries. So one of the question is that this is established by the government, of course, right? And it's a separate facility outside the hospital or within the hospital.
The clinic, the fever clinic, actually was required by the government, both in the government hospital or the private hospital, but they should be set up in the hospital level 3 and level 2 hospital, more than level 2. It is usually in the hospital, but it is usually in a separate area of the hospital because in China the hospital usually is very, very large. There's different buildings, so it is usually in a separate area. And this during the pandemic, all the patients, if you have concerns and want to exclude if he has the COVID-19 infected, all the patients should go to the fever clinic and then take the test. Okay.
And then, of course, there are many questions about the isolation hemodialysis centers. Okay, so I will go one by one. First is, who administers the isolation hemodialysis centers? Are they government facilities? Are there also private people administering this? And who has the governance on these centers?
Actually, this depends. Like in Wuhan, because there's too many infected patients, so the government, they set up a dedicated dialysis center in very short time, and then that was dedicated as a isolation hemodialysis center. But in other places out of Wuhan, because there's only maybe 1 or 2 cases be identified as infection patients, and sometimes they were sent to designated hospitals. But like in most of the dialysis center, they will have a small room or the single room for dialysis patients. So this single room and small room, at that time, they can be considered as the isolation room for those patients under the medical observation, but not suspected and confirmed.
So are these mainly inpatient or outpatient, the isolation centers?
Outpatient.
Outpatient.
Isolation centers for those respective patients and those confirmed patients, they should stay in the hospital, and then they have the transportation, the designated transportation to transport them to the isolation hemodialysis center. But if the patient is under the medical observation, and then they will maybe to original dialysis center to be treated in a single room.
Yeah, and then chest CT screening is also interesting. So a patient walks into your clinic is asymptomatic. What makes the doctors in the fever clinic or before the fever clinic decide that this patient needs this chest CT?
Yes, this is a very important question, but you know, it's very difficult because for us, if the patients, they have no symptoms, we actually cannot identify them before they have the symptoms. So I just can say, the face masks and ask the symptoms, those all that what we can do, and also keep the social distance and hygiene. What we can do is almost there. It is also lucky for us, we have no patient be infected, but I cannot sure we have no such asymptomatic patients. So there is still a lot of discussion about asymptomatic patients, or how they can carry, how much virus they carry. So
yeah, because we had a patient in Singapore recently, in our dialysis facility, who was called for a transplant, and they did a chest CT and was found to have COVID, and then the test came positive. So so this is a very, very difficult area. So we'd like to see whether there are certain criteria, but seems like not to be the case now. And one more question which has come up very consistently is, in these isolated HD centers, is there any special precautions that you want to take more than you would do, such as more PPE? I also want your opinion on this combination of N95 and surgical mask. It's quite an interesting concept.
In the isolation room, we asked to wear the N95 masks, and like in Wuhan, if it's because it's the center of the pandemic, they also wear the full water protection gowns and use the goggles. So I think this depends on what kind of material you have. We need to do as best as we can to protect our staffs and also our patients. But sometimes, you know, during the pandemic period, everything was in shortage. It's quite very difficult. So, but for those high-risk patients, we need to use the N95.
Okay, and then how many, did you have any outbreaks within the dialysis center in China, not necessarily in our FKC centers?
Oh, yeah, we know some reports. There's some reports that not outbreak, but they find several infected patients out of Wuhan. In Wuhan, there's the outbreak, actually. I know that.
In Wuhan there was, okay. And how many cases did we how many cases of COVID did we dialyze in FKC, perhaps? Do you have a number?
We have the patient number is more than 600 now.
Okay, wow. And how many proportion of patients miss their dialysis sessions due to inability to provide dialysis? Maybe they couldn't reach the center, or we did not have, or the dialysis providers did not have the capacity because of the nature of these requirements, as opposed to those who defaulted.
Yeah. For our FKC dialysis center, it's very limited because we encourage the patient to come and stay in the original places. That because the pandemic happened before the Spring Festival, a lot of patients, they plan to go back to their downtown, but we encourage them to stay and not go. So only around 2% patients missed treatment. They reduced their frequency from thrice a week to the twice a week. And we calculated our business treatment number. It's about 94% of the expected.
Okay. And did you see any cases of reinfection in the dialysis cohorts?
Sorry?
Because this is also very reinfection with COVID. It is still quite a controversial topic. I don't think there are any obvious clinical reinfections, but and it is difficult to tease out whether there is a reinfection or continuous shedding of the virus particles.
Yeah, yes. I don't think there is a definite answer for this question. In China, actually, we find some cases they have the virus testing negative, and then several weeks later it's positive. But for those patients, the symptoms are usually mild, not severe, and they will quarantined again and also recovered. So there's a lot of discussion about if it's it's converted to positive, or it's because of the test is not so sensitive. The false negative before. So there's a lot of discussion about that. And recently I saw a report that said that even the patient have the antibody in his already have the antibody like IgM. This antibody can only protect around the 30 days. Maybe the patient can reinfect later, but still we are waiting for more research for that populations.
Okay. Then another question which is cropping up quite regularly is there any special way to disinfect the dialysis machine after treating a COVID patient?
Actually, no. This is the same as usual, but you should do the disinfection very carefully everywhere, and every procedure you should do that.
Okay. What is the cleaning of the dialysis machine? Is there any special? I think it's the same question. Sorry, I will just go through some questions which sort of crop up, but there's a very continuous number of questions being asked. Should all HD patients be screened in view of their vulnerability, as many of them have comorbidities? So the question is, should we be screening all hemodialysis patients? It's an interesting question.
I think if you the normal screen, general screen, I think you should do for every patient, like ask the epidemiology history, temperature measure. Yeah. But for the blood test, for the virus test, it depends on your availability, and also it depends on the sensitivity and the accuracy for the kit the test kit, because for the test there's also a lot of discussion about the sensitivity and the false positive and false negative. So this depends.
Okay.
If you are available, you can do that. Mm-hmm.
Yeah. I guess it's also a question of resource, because we have to be mindful of that. But you agree that all of them have to do the basic screening. Now, another interesting question is, what percentage of dialysis patients require admission to ICU? I presume that's what they mean.
In Wuhan, the report is there's around 60% patients are classified as severe and critical patients, and the critical number may be at 5%. So And also, I think the ICU, it also depends on how many beds in your ICU you can use. In Wuhan at the time, because there's a lot of patients, so the government quickly set up 2 big hospitals to accept those patients with the critical size, a lot of beds.
Okay, and just let me check. I'm getting some prompts from my colleagues here. Let us see. I'll just do a quick roundup of any other burning questions. Otherwise, there's a lot of repetition in these. So there is one very, how shall I say, interesting question again, which says that, is it okay for staff to just wear a surgical mask, goggles, and without actually doing the full PPE for dialysis staff?
This is for the standard dialysis, not the infection.
For standard dialysis, I presume it means standard dialysis.
Yeah. For the standard dialysis, we use the surgical mask, face shield, and the gown. That's almost all.
Okay.
I think it's fine. It's sufficient.
Okay. And can patients under medical observation dialyze together?
No. We separate the patients under medical dialysis from the usual the other patients. So if you have the facilities, you can put them in a single room to provide the dialysis. But if you have no these facilities, I think you should put them in the corner or in the end of the row in the dialysis area, and use the curtain or something like that to have a physical separation and keep some distance with other patients.
Yeah. Then, there's also a lot of controversy about the physical distance that is required. So it says that the virus can travel up to 4 meters, but the general advice is usually 1 meter, 6 feet, 2 meters. So there's a lot of incongruency around this thing. And what is your view?
In China, we suggest only 1 meter, but I think that depends on the population density in your country, because China, the population is too high. So we just suggest.
And as you move now from the first wave to the second wave, I hope it is not very as bad as the first one. But what are the main learnings that you would like to sort of apply for the second wave, and what changes would you make for the second wave?
Actually, in China, we are gradually return our work and recovery, a lot of entertainment places. But we still, because the second wave usually is from the imported from the outside of the country. So there's still a very strict procedure on the site of the airport, the train stations, and some immigration office. So I think it's for our populations, we think it's quite safe actually in the country, inside the country. But we still always wear our masks and wash our hands and keep some distance. And the group dinner and the entertainment just gradually reopened.
Yeah. So then another interesting question is it acceptable to decontaminate the N95? I presume this is because we have quite a big problem of securing N95 in many countries. And if so, how? So basically reusing the N95 mask.
Yeah.
So, any thoughts on that? Whether we could reuse the N95, and if so, how? How would it decontaminate? Okay, perhaps this is not necessarily a question for Dr. Grace, and we really cannot give advice on this. Can we reuse the dialyzer of COVID-19 patients? I would like to say that we do not recommend you reuse dialyzers in first place. So, but if you have to, the same principles of any virus would apply. So I think we can move to the next question. Is there any fever clinics in Singapore? So not to my knowledge, we do not have fever clinics per se here, and we do not have dedicated dialysis centers apart from those for confirmed patients. But the symptomatic but non-COVID cases or not confirmed cases, I know there is a lot of discussion going around in Singapore about how we best cater to this group of patients, whilst being aware of the extra burden it will place on the existing resources, because we are, of course, going through a massive surge of cases now. Okay, I think it is impossible for me to actually screen through all the questions at such a short interval. So maybe what we could do now is we will collate all these questions on the back end and probably find some trends and get back to you, Grace, and we try our best to answer and get back to the participants. But at some point we have to draw to a close, and we would also like to highlight to you, which is that there is a survey at the end of this seminar, and I know you have all given a lot of your time, but we would really appreciate your evaluation, because this is one of the first live webinars we are doing on COVID. There will be more to follow, and it will be our endeavor to keep on improving as we go along, and your feedback will be the most important tool for us to do that. So just a quick reminder for all the participants to give us a few more minutes from your time and complete the evaluation survey. And again, I'm really sorry that we cannot answer all the questions, so we will draw to a close. So first and foremost, I want to thank you, Dr. Grace, for taking her time out and making this great presentation. Also to all the participants, and as I mentioned, we are quite humbled by the overwhelming response and number of participants we had. So it has also encouraged us that we will do more of this in the future. And lastly, to a lot of my colleagues who have been working in the background and who have made this actually happen. So I will pick up some names. It's not because of favoritism, but because of my bad memory. So Diana, Joyce, Justin, also Gabor, Stephen, who have actually made all of this happen. So thank you, everyone. And if there is nothing else, Diana, I think we could close this session. I also want to lastly very quickly highlight that my colleague Dr. Nanda Kumar, who is now the director of medical director for FMC Singapore, was supposed to be with me, but due to our social distancing norms, which were heightened yesterday, we were not able to do this session together. So he can also be reached out if you have any Singapore specific questions, and then in turn we can get back to you. Thank you very much, everyone, and have a nice day.
Thank you.
Thank you, Grace. Bye.
Bye-bye.